What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we'll cover what to expect as X-ray tech students, your clinical, the Floro exams. So we'll cover from the beginning of your journey towards as you progress and you get more skilled in the Floro game. To give you context, I am an X-ray tech night crew. I work at a trauma level 3 ER, or the whole hospital basically. Nighttime you do hold it down. Nighttime you don't do really much fluoro. There's not zero, but it's little compared to days. But anyways, as a student, I would say the first couple of weeks when you're in clinicals, especially if you're in the main department, that is where I would say 90% of your Floro exams will take place, and I'll cover the 10% in later on. So when you're a student, you'll get there, and every single place has a different way they like to do their procedures. The concept is relatively the same, but what kind of tweaks it will depend on if you're going to be helping or assisting with the radiologist or an RPA, rad tech physical assistant, RPA, those two, and depending on your side, the protocols. But once again, it's like the same thing. Like if you do an enema, it is still an enema, it just may be done differently, different steps, different ways they go about, scheduling or the actual physical procedure. So you have to keep that in mind. So when you're a student and you're just studying, just try to get the concept of what like an enema is, or what a barium or an esophagram, just try to get the general gist of what it is. And then when you go in there, the techs or whoever, or the rad, or usually it's the RP, depending, will kind of guide you, because the tech will know, okay, it's so-and-so, he likes it like this. You as a student, of course, you're not going to know, so you would rely on the techs to help you, to make it smooth on you. So generally, they'll have some places have a little sheet that will tell you that if it's so-and-so, you got to lay certain stuff like this, or the glove sizes are like this, or certain people, it's kind of niche depending, but it's kind of the same way as the general questions you will ask the patient. Maybe like the RPA or the radiologist would like you to give them a brief summary to the patient of what it is, what's going to happen, and all that shebang, and then get the rad or whoever is above you actually doing all the actual procedure, and you're just assisting. Other ones just want you to get the patient in there, and then they come in, the rad or the radiologist come in there, and then they tell the patient the whole shebang, if they have any questions. So it all kind of depends. With time and with your thing, you'll kind of get a gist. So usually the first few procedures that are done, usually as a student, you just watch, and then if you see it and you feel comfortable, you'll assist, and then once again at the very end, you'll check off, and you'll kind of do everything by yourself, and either the rad tech will be there just watching, because sometimes stuff kind of goes off the deep end, and maybe the procedure doesn't go as smoothly, and you may need extra stuff, or more equipment. Certain, with enemas, let's say they have an explosion, and you gotta there's certain stuff that as a student you're not ready for as much, because certain situations, the patients, no one gets these exams because they're healthy and they're good. Usually there's something wrong with the patient. They're trying to see what's going on. Especially with enemas, it's either an obstruction or they have other stuff going on. So it's kind of very niche on that situation. And then the other 10% I was talking about the Floro exams is for a small bowel. Let's say you have someone, usually they'll start off at the main department to do it, and then usually they'll be inpatients, so you'll do it, bring them down, shoot an X-ray, okay, let's say an hour passes by, shoot another one, you'll shoot more, and then maybe the main department gets busy, so they'll send the patient up, and then I think it's every hour after every 15 intervals, and then 30 minutes, and then an hour. It's like every hour it goes into an interval, and then you'll shoot like a KUB to see as the as the contrast goes through the small bowel and all that stuff. And by then you're either shooting it from the ER, they'll send you, like if you're in the ER, they'll send you to go up and shoot it. Depending if like the main department has time, they might go up there and shoot it themselves, all depends. And then at that point, it's up to the rad, to shoot it and be like, hey, we'll usually have a pretty good general idea of where it has to end on the patient, but as always, the rad or the RPA at the end of the day has the decision to tell you, hey, keep it going, or hey, we're good. They're the ones who make the call. Keep that in mind. So that's for small bowels. Let's see what else. Oh, and then sometimes on the weekends, what will happen since usually on the weekends, the main radiology department and the outpatient departments are closed, so usually it's just the ER. So during the weekends, what will happen is the RPA or the radiologist, depending on what's going on, that's for daytime, to give you context, will come in, or they'll message the text, be like, yo, do we have anything going on, or is there any orders put in? And they'll be like, okay, yeah, there's so-and-so. And he's like, okay, it's a small bowel, or it's this and that. And they'd be like, okay, so go up there and do this and that. I'll meet you up there. Or we're going to schedule it for another day. And those situation is when they start a small bowel. Let's say they start at like 3. Those could technically push into night shift and could come into my department, to my shift. But usually by the time they get to my shift, like you'll probably just shoot maybe 1 or 2 exams. KUBs. And then as far as night shift in general for any contrast exams, the most we'll do is like if they put in a new tube on a patient, like we'll just shoot a KUB, we'll put gastrographin in their little tube. That's the most common one we see done at night. Or if they need an esophagram because of aspiration or other stuff. But it all depends on where you work at, because depending on the rad, ultimately it comes down to the rad. In a general sense, if the rad is gone, majority of the time they will probably wait till they get there in the morning. Unless that's a real emergency case and the doctor is able to convince the rad to come, that will be something. But 9 out of 9, literally in our department, here in our hospital, 9 out of 10, usually the rad's like, nah, morning. We're not gonna. In my 2 years of working at this hospital, I've just done 1 Floro case. It was an esophagram. I didn't even do it. It was the veteran tech was there who did it. And I was holding the ER, but like as far as I've only had 1 in my shift. Like true, like you have to go to the main and get all that stuff. And usually the rads or whoever comes in, they're more lenient and more, understanding, because your night shift, they know like, okay, yeah, you know how to do the job, but you don't really know the specific of all the little quirks and stuff I like. So usually they're more chill for the most part. So yeah. Hope you enjoy this content, this video. Keep on making more niche content. As always, it's been your Booba Mogul. See ya on the next one.